Beautiful. So welcome everyone. My name is Krista Ellis. I'm with the Parkinson's Foundation, and I am your host for today's Mindfulness Monday session with Dr. Taylor Rush from the Cleveland Clinic. I want to thank each of you for joining us today for our mindful meditation for Parkinson's disease. If you're new to our program today, please stick around following our meditation session so I can share with you upcoming events and a little bit about the mission of the Parkinson's Foundation. Just running through some housekeeping items. Everyone will be muted during the session, just allows us to have a clean and clear audio of our meditation session to eliminate some distractions, to make the meditation challenge a little bit easier. We are a very engaged community, so if you have questions, comments, anything that you'd like to share, please do use that chat function. You can find that chat at the bottom of your Zoom viewing page. Let us know where you're tuning in from, or if you have any specific questions about meditation, mindfulness for Parkinson's disease. I do encourage everyone join us on video. We love to see your faces as we meditate. Just gives myself and our meditation experts some feedback on how you're resonating with that meditation. Our next live English session will be September 27th, and I will be guiding you through a self-care practice and a little bit of mindful movement. So make sure you check your registration email for details. There will be a little bit of prep in order for our event and time together to be optimized. So you will need some props for our next session on September 27th. And then following September 27th, we will jump into the month of October with a mindful meditation on mental well-being. So make sure you check your calendars and get that registration done so you can join us on Zoom. This Wellness Wednesday, September 15th, we are offering an educational program for our newly diagnosed community. So if you are here and recently diagnosed with Parkinson's disease, recent can be from a day to a week, a month, even a couple of years, and you'd like to learn about how to build a better life with Parkinson's disease, please do not hesitate to join us this Wellness Wednesday. You can join and register by finding our webpage at parkinson.org/pdhealth, and Jennifer will drop that link into the chat for you guys. We'll also be sending out a little survey after our session together. So when Dr. Rush finishes her session, we'll drop a link in the chat. So please do make sure you fill out that link. I'm actually in the moments of creating our curriculum and our program for 2022. And your survey results, your feedback, your comments will really help me build a curriculum that's best for us in our community. So please take some time to give me some feedback. Great. So Dr. Rush has something very special and new planned for us today. So I'm very excited for us to hear from her. Dr. Rush, joining us from the Cleveland Clinic, thank you so much for your time today and your expertise. Let's get started.
Wonderful. Thank you so much, Krista. Hi, everyone. It's good to see all of your faces today. I'm so happy that you could join us this afternoon. So today I wanted to talk a little bit about mindfulness and one's sense of identity. So our sense of identity is how we see ourselves, how we understand ourselves, our value, how we see ourselves in conjunction with others in our life and in our worlds. And I will tell you that as a health psychologist, a lot of my training, a lot of my background is better understanding how individuals who have chronic health conditions changes one's identity. We know that having a chronic medical condition such as Parkinson's affects how someone functions, how they think, how they're able to plan for the future, as well as how they see themselves. And often when I'm working with individuals who have Parkinson's, our conversation often inevitably drifts to one's sense of identity and how that has shifted as a result of their Parkinson's symptoms and how they're able to live their life. And so I thought it would be nice to talk about some of that and how it relates to one's mindfulness practice today. So I wanted to first talk to you a little bit about what we call in the business illness identity. So there is a questionnaire that's actually called the Illness Identity Questionnaire that was created by Orris and colleagues back a couple of years ago. And they talk about several domains of someone's identity in relation to their medical illness and how that can affect their life and their ability to cope with their illness. And so two domains that are talked about in this questionnaire are rejection versus acceptance. So rejection is the degree to which someone's chronic medical condition is rejected as part of one's identity. It's viewed as being unacceptable. It's viewed as a threat. And for some of my patients who have Parkinson's, and sometimes maybe more so in the earlier stages of Parkinson's, when their symptoms are a little bit more mild, they say, I'm not going to think about the fact that I have Parkinson's. I don't want to hear about Parkinson's. I don't want to know about what the future may hold. I'm just going to live my life as best as I can while pretending it doesn't exist. On the other end of that is acceptance. And acceptance is the degree to which someone is able to accept their illness as part of their identity without becoming overwhelmed, knowing that their chronic medical condition may play a role in their identity in terms of what they do, their relationships, some of their social endeavors, doesn't make up the entirety of who they are, but it's part of who they are. And so it doesn't overwhelm them, it doesn't engulf them. And in some ways, it can actually sometimes enrich them. And I've had some of my patients with Parkinson's who kind of are working through the middling of accepting their Parkinson's status, saying, it's given me a better appreciation for what I can do. It's helped to enrich some of my relationships because I realize tomorrow's never guaranteed to anyone, and that feels especially true now. So they feel that there are ways in which that their Parkinson's has actually helped to enhance their life. And we know based on the research that's done on different chronic diseases, is that people who are able to kind of integrate their medical condition into their identity, rather than rejecting it or becoming defined by it, do better in terms of their quality of life, as well as with their disease management. And so the more we can kind of walk that fine line between acknowledging and accepting Parkinson's and how it changes us versus becoming engulfed in that is all we see ourselves as. If we can walk that fine line in between and recognize that it is part of us, but not the entirety of us, tend to do better in terms of management and living the life that we want. And so when I work with people, I definitely, hear them talk about struggling with integrating their Parkinson's symptoms with their identity. And many people struggle with a shift in maybe some changing roles that they experience as a result of this. Someone may have been working and now they're not as a result of their advancing Parkinson's symptoms. They have maybe been a main provider in their household and taking care of others, perhaps their entire life, and now are needing to be on the receiving end of care. And so they very much defined themselves in terms of their identity by the roles they have played, rather than necessarily who they are as a person. And some of what I notice with this struggle that people experience kind of boils down to somewhat of a reality rejection, that Parkinson's has changed what I can expect from myself and what my future may look like, and I don't like it. And so I see that some people often will experience high distress, discomfort, sometimes depression, anxiety, because they hold tightly to a very fixed view of themselves. So if I'm not a worker, if I'm not a caregiver, if I'm not in these roles that I used to play, then I am not worth as much. And that's a profound peace that many people end up struggling with, this sense of identity, this sense of worth, this sense of contribution or purpose, because it does shift as a result of their Parkinson's. But just because it shifts doesn't mean that it's then an impossible task to have a life and to recognize the strengths that one has as an individual. And something that I really like that I read once is that pain and loss is not an endpoint. And so recognizing that certain roles that you may play come to an end, certain parts that you play may have to change, but it doesn't mean that that's the end. It just means that it then transitions to something else and it's fluid. And so in terms of mindfulness, I feel like often when we start to practice mindfulness skills and meditations, it helps us to better acknowledge some of the shift that occurs in the self that occurs with Parkinson's. And so if we think about some of the tenets of mindfulness, it's intention, attention, and attitude. So intention is being able to be deliberate about what we focus on. Mindfulness is about being able to see what's going on right in front of us and not go too far forward in the future or too far back in the past. We are intentional about trying to stay in the present and using that attention to redirect from maybe unhelpful, non-productive thoughts. So when we start to ruminate on what no longer is, when we start to, be concerned about the future that we cannot predict, and instead refocusing and allowing ourselves to bring our attention to what's right here, right now. And then our attitude about what we experience in the present. So remember, with mindfulness, it's being non-judgmental. It's about being patient. It's about being compassionate towards oneself as well as others. And it's also about letting go. The more we hold on to things that no longer are, the less and less it tends to serve us. And so I thought we could practice a little bit of an introspective meditation today as it relates to the self and sense of identity. So I encourage you to show a little bit of bravery with me here today, and a little bit of trust that hopefully that this can be something productive and helpful for you. So go ahead and get comfortable in your chair. You can either close your eyes or find that fixed point, maybe 4 to 6 feet in front of you on the floor, so that you can just have a soft, fixed gaze. Scan your body in its position, noticing where your feet are, where your sit bones are, how your spine may be aligned to the back of your chair, shoulders, allowing the hands to rest. And settle on the focus of the breath, as we do with most meditations. Noticing the sensation of the breath as you breathe in and breathe out. Allowing this to be your anchor throughout this exercise, so that if you notice yourself feeling overwhelmed or that your body starts to tighten, you can always bring it back to the breath. So now I want you to open your attention to thoughts about yourself, which can often be an uncomfortable or difficult kind of focus. For a moment, I want you to think about how you may have defined yourself your sense of identity before you were diagnosed with Parkinson's? How did you see yourself in terms of the roles that you played, the characteristics you possessed, who you were at your core? And then gently ask yourself, how do I see myself now with Parkinson's? Compassionately notice any differences from the way you defined yourself before Parkinson's. Are there any expectations you might have previously held prior to Parkinson's that maybe no longer serve you? Are there any new parts to yourself that are asking for acceptance? Physical changes that may have occurred as a result of Parkinson's, emotional changes, relationship changes. What do you notice about your body as you ask these questions and make these observations? Any tightening of different muscle groups? Changes in your heart rhythm, your breath rhythm? Can you note what emotions you may be experiencing as you reflect on this topic? Just allowing yourself to gently acknowledge them. I want you to refocus your attention away from roles or expectations you have played and focus more on the person you are, your core characteristics. It can range from anything: humor, love, wisdom, curiosity, authenticity, openness, compassion. Taking a moment to honor who you are rather than what you have accomplished. And recognizing that your identity transcends Parkinson's, and in some ways may even be enhanced by the experience of managing your Parkinson's. How maybe it's opened your heart to be more compassionate, experience more gratitude. remembering that your being is not just a collective of what you have done or how others perceive you. You are meaningful in and of yourself. Recognizing that identity is fluid. And perhaps setting an intention when you need to recognize to practice compassion with these changes. Anchoring back to the breath. Reflecting briefly on this experience with asking these questions. Allowing yourself to recognize and appreciate your identity and its changing parts. One deep breath here. When you're ready to come back to the room with us, wiggling those fingers and toes, opening or focusing the eyes. Restarting the day, a perhaps slightly different perspective. Right. See some eyes opening here. So I am certainly open to comments, thoughts that some may have. So let's see here. I apologize if people had any audio difficulties, if that may have been my possible challenge on my end. Let's see. Someone mentioned, let's see here, not working has left a hole in one's life. And I will say that that's definitely a piece, because so much of many of what we do is, the roles that we play. If someone has had a job that their life ends up becoming a large part of that is working, it can absolutely leave a sense of absence and of lacking in some way. And so often what I will tell people is that there may be ways in which our lives change, and that can cause some holes, and we don't necessarily fill the hole with something else, but we learn how to build around it, and we learn how to create something that looks very different than what may have been there before. So I agree that that creates some work, but it is often work worth doing. Let's see here. Other thoughts. I appreciate differentiating between accomplishments over ourselves. Yes, those are, I'd say those are two very different constructs. Who we are as a person versus what we do as a person. We are not solely the product of our productivity. We are so much more than that. They're just being, we are important. Thoughts? I know Krista always has wonderful insights. I don't know if she has any that she'd like to share.
I did get a question from one of our participants today who asked if this session was for care partners or for people with Parkinson's disease. And there were a couple of times, Dr. Rush, when you were able to speak to the group collectively, and other times more specific to the person living with Parkinson's disease. But I think it's important to note that an identity does shift as well for the care partners involved with their loved one living with Parkinson's disease. So maybe you could just touch a little bit on the identity shift or the acceptance of their new role, and perhaps the adaptation of their role and identity with their loved one living with Parkinson's.
Absolutely. I think it's so important to recognize the role of care partners and how Parkinson's affects them, and as well as their sense of identity, because similarly to the person with Parkinson's, this is not something that they expected. It's not something they had anticipated on being a part of their life, and now they find themselves in a slightly different role than what they would have otherwise played had their loved one not experienced Parkinson's. That's through no fault of anyone. I think there's a lot of feelings of guilt from the person with Parkinson's about this, even though it's not something you chose either. Guilt implies blame, and there's no one to blame in this situation. Mm-hmm. But for the person who is the care partner, there is this shift in their what they can do for themselves and what they're able to do for their loved one, and what their social composition may look like, as well as their sense of self. And so maybe they've always seen themselves as a problem solver and someone who can just tackle this and be able to manage it or get rid of the problem. And this is not a problem that can be fixed. This is a problem that's managed. And so being able to say, I am not the fixer of this problem, and that shift in their identity can definitely be a struggle. And I actually work with quite a few care partners on these types of issues, and saying, I want to be this type of care partner. I have this sense of identity that I should have. There's also this idealized sense of what they should be. I should be the perfect care provider who never complains and never has a bad day and never has any issues, and I should never take that out on my partner who has Parkinson's. And that's not really realistic either. And so recognizing that there's stress that comes with this role, there are needs that need to be met. And so recognizing that some of those expectations of what they should be as a care partner also have to be let go of, because they don't serve anyone well. So, but I could go on about that for a while, but I'll leave it at that for now.
No, I think it runs perfect. And one person wrote in the comments, when you would say person with Parkinson's, she would insert herself, in the language of her own mind, care partner. And I think that's relatable to any meditation that we kind of embrace here in our space together, is whatever you resonate with, the label, the identity, however you define yourself, whether that is a person with Parkinson's, a care partner, a loved one, a daughter, son, or somebody, you are able to really make this experience unique to your situation. And using myself and Dr. Rush's guidance to make your experience your own here in this space. So I thank you, Dr. Rush, for talking a little bit about the identity for our care partners as well as our people with Parkinson's, because it is an entire community.
Absolutely.
Well, that is our time, you guys. We're actually 2 minutes over. Sorry, Dr. Rush, if you have a patient waiting. Please let us know what you think about our sessions. I do tremendously review and rake through every comment that you make in these surveys that we're asking you to fill out. So please click that link that Jennifer just dropped into the chat. It'll open up a new window as we close out. Next Monday, we're doing something a little bit different. We're doing mindful movement. So make sure you check your registration email. You're going to need to set up a little bit before our session and wear comfortable clothing that you can kind of move freely. And it will be a different experience from us sitting in our chairs the way that we do in a very static position, but it is meditation. And of course, we all know how important movement is for the body, whether you are a care partner or a person living with Parkinson's. Movement is so important for the body, for our mind, and for our thoughts. So come prepared, read that email registration. All right, you guys, I will see you next Monday, September 27th. Stay true to yourself and stay kind and stay humble and have a blessed week. We'll see you guys next week.